spoke to her over the phone, and she explained to us what the primary contacts are, the secondary contacts, tertiary, and all that. We are going to put them on the on our Facebook wall, okay? And she said vehemently that 198 cases are not the Ebola cases.
That's true.
Exactly. So you clarified that. So the figures presently are that 61 people have been cleared.
Yes.
Okay. And how many people are confirmed infected now? Just 4 on admission.
Yes. 61 people cleared in the sense that they were never infected. They were on the contact list to be watched for maybe a development of the infection. They never had symptoms, so they were not they're not considered part of the surveillance.
Yes.
As in the suspect that we watch because they are symptomatic.
Okay.
Suspects become confirmed if they test positive.
Exactly.
Of the tested positive, 12 so far.
Okay.
5 have been cured of the infection.
Exactly.
And like His Excellency said, infection with Ebola is not automatic death sentence, and you've been able to prove that. Early presentation, don't be timid, don't be scared. If you have fever and you feel you've been in contact with someone, whether directly or indirectly, that might have been infected, please come in early. There is hope for you if you are a contact. Don't go and hide, don't go to a church, don't go to a mosque, don't go and check yourself into a hospital and start treating yourself. We have experts on the ground. Lagos State has everything in place to take care of you.
Yes, excellent. I want to use the opportunity to say a big thank you to the Lagos State government. You guys are doing an amazing job, and we always sing your praises here on Nigeria Info. Now, I want to also talk about, you said 5 people cured. People, part of the leaflets that we have and what we keep broadcasting is that there is no cure. So please, can you explain that?
There is no cure in the sense that when you become infected, the what we call case fatality rate is very high. And because of that, the intensive care given to the patients, all these 5 people had really sick episodes that at one point it looked like they were hanging on to their life. But with intensive care, if fluid replacement or what was needed, they were bombarded with care. Medications of all the constitutional symptoms they're showing. But the virus itself has no cure. You can't give the patient an antiviral and then cure the patient.
Exactly.
So the virus kind of outlives itself in the body. When it outlives itself in the incubation period, and we support the person. If the person has no support during the incubation period and is affected, they don't make it.
Exactly.
So that's why we say it has no cure. But the cure is in the person overcoming the infection.
Exactly.
And with serious intensive support, and I'm saying very serious intensive support of all the body system, because the body system shuts down. It really is a very virulent and aggressive virus. And once that happens and the patient the immune system starts to pick up, when the virus starts to die out, that is when they become naturally cured of the infection. But nothing, no pills, no vaccines, nothing can cure someone who is infected. And they have immunity for life once they overcome the infection.
The question that I wanted to ask. So if the person has been confirmed to have the virus, and the person is lucky enough to outlive the infection with early detection and support, medically, that the person's losing fluid is being replaced, you're losing blood is being replaced, the kidneys shut down, they help the person and support them through that. After that dark period, the person can survive and becomes immune to the Ebola virus, at least the strain that they contacted.
There are like 5 strains.
Yes.
And there's a belief there's a cross-reactivity between the strains.
Okay.
But this particular one, the Zaire Ebola virus strain, is the deadliest of all 5 of them.
Wow.
So it is a thing to celebrate in a way that we have been able to care for these people, supported them. And this goes to, if I could just put it in now, because there was a lot of media campaign, negative campaign about Lagos State doesn't have this, it's not doing this, they don't have water, the place is dejected, nobody's caring for anybody. But we were sure of what we were doing, and this is proof that we were doing the right thing.
Exactly. I'm just so happy that at least we have 5 people cured, and you said also that 4 of them are on admission, and 3 of them are doing very well out of the 4.
They are still hanging, but they have not deteriorated.
Okay. Yes, if you're just tuning in, we're talking to the Special Advisor on Public Health to His Excellency, the Governor of Lagos State, Babatunde Raji Fashola, and we're talking about the Ebola virus, okay? I just want to emphasize, for you to emphasize on something that you mentioned during the meeting, that's the community development, the meeting we had with the Community Development Committee, when you mentioned about referring the patient. I want you to stress on that, because some people would see a patient and they have a fever, or people now use infrared thermometers and they scan at the door, for instance, of the hospital. What should they do, for instance, if they see a suspicious case?
Well, first I want to emphasize on the prevention as an individual.
Okay.
We talk about, we need to block the borders, the airport, but we have illegal routes. We have underground places where people come into our country. So you cannot totally block all the borders in Nigeria.
True.
That's one. So if we can't do that, we can't stop people coming in, and we can't tell who's going to come in next with the virus. So it starts with you as an individual. Personal hygiene, extreme. We didn't have to have Ebola in our society or in our system to start practicing good personal hygiene. But if there was ever a time to start, it's now. Wash your hands, wash your hands, wash your hands. Soap and water, wash your hands. Sanitizer, it's an alternative if you don't have soap and water. But if you have soap and water, it has no other alternative. Wash your hand with soap and water. Beautiful. The second thing is body contact with sick people.
Okay.
That we know for sure that Ebola is transmitted only when the carrier is sick. So when you're handling anyone who is sick, especially sudden onset of fever and rapid deterioration thereafter, regardless, again, we didn't have to wait for this for our healthcare providers to learn to wear the gloves when they handle sick people. It should be standard infection control precautions. So the doctors that are scared, well, maybe there is a reason to be, but as a professional, you know that when you're handling a patient, you wear your white coat. That's the reason why we wear white coat. It's not to look like a doctor, but to protect your exterior. And it's not for you to take your white coat home. You're supposed to leave it at the hospital, and the hospital is supposed to take care of the way you clean it, because you come into contact with all kinds of things in your white coat. Then wear your gloves. Ordinarily, when you're taking history from a patient, you've not had contact. You're talking and you're taking a history. But when you want to touch a patient, especially when the patient is sick with a fever, you, in this time and age that we have this Ebola virus disease going on, wear your gloves. Wear double gloves if you must. It makes you feel comfortable. But sending the patient away is totally counterproductive. And it is disappointing to know that a medical doctor who's turning a patient away does not understand the pathophysiology of the Ebola virus disease. You don't have to send people away that have fever. Worst case scenario, set up a triage at your front desk. If you have a fever, stay in this room. If you're well, you come for a physical screening, wellness check, antenatal visit, immunization, and all of that. Put them in a separate area. Then when you're questioning them, have you had contact with someone with Ebola virus disease? No. Have you traveled to any West African country in the last 21 days? No. Have you done, I don't know what else there is there, but the basic thing is fever and recent travel or recent contact. Then you have the constitutional symptoms: diarrhea, vomiting, body aches, joint aches, rashes, nausea, sore throat, all those things. Then bleeding from all openings of the body, then you start to have a high index of suspicion. You need to wear your gloves when you're handling sick people. Wash your hands, dry them, put on your gloves, 1 or 2 if you like 3.
Right.
When you take them off, wash your hands again. For those that are taking care of sick people at home, they must do the same thing.
Okay.
Because what we found is the patients that came down positive had been cared for by their family members.